So, what is cellulitis? Cellulitis is a serious skin condition. It's actually a bacterial infection that you can get very sick from. It's in the top couple layers of skin, and it can go deeper. Matter of fact, it can start attacking your fascia and your muscle, depending on how bad it gets.
What's the fascia?
Fascia is what holds your skin to the muscle. Cellulitis is red and it's hot to the touch. It almost looks like a rash. It can appear in your armpits, your arms, your legs, and your groin. Anywhere where your lymph nodes can't drain is where cellulitis can occur. It usually happens to people that are middle-aged. Usually young people that have good skin are not good candidates for cellulitis. However, obese people, old people, and people with skin problems like eczema and just bad skin in general can get cellulitis. Symptoms of cellulitis. Basically, if your skin's red, you're definitely a good candidate. Also, fever and chills. Now, when I first had cellulitis, I had fever and chills. I thought I had the flu. I had no idea I had a bad skin infection that could affect me enough to send me to the hospital. Also, sweating, swelling, and skin color. If your skin color is not only red but dark, you can still get cellulitis. There's a few things that can give you cellulitis. Cuts on the skin, like gashes. Cracks in your skin, like if you have athlete's foot. Bug bites, mosquito bites, spider bites, and general cuts in the skin can get you cellulitis. Now, cellulitis has two different bacteria that causes it. Strep infection, the same you get in your throat. Staph infection, which is most commonly found in gyms. Also, MRSA or MRSA is a big concern when it comes to cellulitis. MRSA, however, is antibiotic resistant, and if you have that, you are in trouble. Risk factors that can lead to cellulitis are obesity, especially in reoccurring cellulitis. Any kind of injury and immune problems. For instance, diabetes, HIV, and anything else that weakens your immune system can worsen cellulitis. Drug use. A lot of people who use a lot of drugs, like dirty needles, they're very prone to cellulitis. Any kind of edema. If you have a lot of fluid, you retain a lot of fluid, and you could either have lymphedema or just regular edema, you're most likely a great candidate for cellulitis. Prevention, cleanliness. Keeping a lot of garments on your skin can prevent cellulitis. Compression socks to keep edema out of your legs and limbs can prevent cellulitis. Complications of cellulitis include lymphedema, damage to your lymph nodes, and flesh-eating strep bacteria. If it's not treated right away, it will not only eat your fascia like we're talking about earlier, but become antibiotic resistant, and eventually you're going to have your limbs removed. Why am I talking about cellulitis? Because it affects me, it's reoccurring, and since September, I've had it 4 times. Thank you.